My name's Tim Allardyce, physiotherapist and osteopath. I am a rehabilitation specialist, so I spend my time rehabilitating people before and after injury and surgery. So what is a rotator cuff tear? Well, first of all, to know what a tear is, we need to know what is being torn. The rotator cuff, there are 4 rotator cuff muscles and they sit around the shoulder. So here's the shoulder joint. You've got the collarbone, the upper arm or humerus. Here's the ball of the socket and here's the socket. And the shoulder blade is here. So the supraspinatus or rotator cuff muscle sits in or just above the shoulder blade, and the tendon attaches to the humerus or upper arm bone. As you lift the arm, so the tendon retracts back and forwards. Unfortunately, what can happen over years and with aging, you can get small osteophytes and thickening around the joint, which causes something called hypertrophy and eventually causes osteoarthritis of this joint. And it causes small bony fragments to appear under here called osteophytes. And these osteophytes can pinch into the tendon and can eventually tear the tendon. Or if the tendon is degenerate and you have a fall, then the tendon can snap. If you imagine using your shoulder over a number of years causes the tendon to wear, and eventually it can wear through the width of the tendon and tear the tendon. One of the first signs that you've torn your rotator cuff tendon will be a lot of deep shoulder pain and an inability to lift your arm. So if you have trouble lifting your arm above your head or lifting your arm to your side following a fall, or you've got a long period of pain in your shoulder and gradually the arms got weaker and weaker, you might have a rotator cuff tear. If you're not really sure, you should really see a physiotherapist. They're in the best position to diagnose if you've got a torn rotator cuff. If you can't see a physiotherapist, then get to see your local osteopath. Seeing your GP can also be useful for pain medication and pain relief. Once you've seen your physiotherapist, they'll do an assessment on your shoulder. So they'll get you to lift your arms and check how strong your shoulder is. Once you've seen your physiotherapist, they'll assess your shoulder and determine how much range of movement and or weakness you've got. If there's a particularly bad tear in the shoulder, they may recommend you to have rotator cuff surgery. So what happens during rotator cuff surgery? Well, what they do is they make a small incision into the shoulder and they first of all decompress the bone in the shoulder. So they trim a small piece of bone. That then gives more space in the shoulder joint. Then what they'll do is they'll probably use a double row technique where they stitch the tendon back together. Now the problem with this is that tendon might be quite degenerate and might be quite thin. So the stitches have to be double rowed to keep them really solid, but there's always a risk those stitches could pull out. However, all being well, the rotator cuff will be stitched together and it will take about 6 to 9 months, usually towards the 9 months, to fully rehabilitate following rotator cuff repair. When you come out of surgery, you're obviously going to be in a lot of pain. They will use a nerve block and an anaesthetic to help reduce the pain, but you've just had a tendon stitched back together, attached to the bone, and the bone trimmed. So expect it to be painful. You'll be in a sling for up to 6 weeks, and that sling's going to restrict your movement. That means when you take your arm out of the sling, your arm's going to be stiff. So expect stiffness following the surgery. So it's very, very important that you do your exercises, passive exercises, to get the shoulder gently moving. But we don't want to do too many active exercises because we don't want to overstrain the shoulder as well. So it's a real balance between gentle passive exercises to get that shoulder mobile to stop the shoulder stiffening up.
Well, basically, I've been a builder for over 40 years, and what happens with shoulder cuff rotators is that they generally wear as you get older, but also they can be snapped or stretched at any time with an injury that can be, like, for example, for me, was probably falling over skiing, or as on the other shoulder, falling or toppling off a horse. It's very important that you, first of all, go to a physiotherapist to get advice. But then when you find out that it's looking like you need surgery, it's very important that they're operated on and tied back to the bone as quickly as possible. It's very important, once you've had the surgery, not to react to any physical or something. You're obviously going to have extensive pain at the beginning, and you will find it for the first 3 or 4 days, up to 10 days, extremely difficult to sleep. Yeah. But having said that, it's very important, I think, to act as quickly as possible when you've got that sort of tear, and act on your physiotherapist's advice.
Over 6 to 9 months, usually 9 months, the shoulder will gradually repair and you'll get more range of movement. It's entirely normal to have about 80 or 90% of full range, so don't expect to get 100% range back after rotator cuff repair. In the early stages, sleeping is going to be difficult. So either sleep on your back, reclined with pillows, or sleep on your good side and hug a pillow. That will give the shoulder some support. And make sure you use ice regularly over the tip of the shoulder. Place an ice bag for 5 to 10 minutes, 3 or 4 times a day to reduce the inflammation. And you can use that for several weeks to really get the swelling out, because it will take around 3 or 4 months to get the swelling down in the shoulder. Work with your physiotherapist to improve your range of movement and then to strengthen your shoulder.